They snuggle, they kiss, they sleep with me, everything.
Your animal companion understands you more than you may realize, and it turns out we understand less of them than we think we do. So what can we do to keep our pets and ourselves healthy? The morning medical update starts now. Good morning. It's Tuesday, May 31st. I'm Alexis Delcid in for Jessica Lovell, who's enjoying some much needed time off this week. Thank you for joining us here on Facebook, YouTube, and Twitter. Coming up, we also have a big announcement involving our shows this summer. Jill Chadwick, our news director, will join us with what you need to know. Also, coming up in about 15 minutes, we're going to be joined by Dr. Hawkinson with the latest COVID-19 numbers. But first, who doesn't love a kiss from their dog? We're going to tell you the steps you do need to take to make sure that lick doesn't get you sick. So make sure to get your questions sent in to us on YouTube, Facebook, Twitter, and the Medical News Network. You find the links to those right here on your screen. Letting your dog lick your face, eat from your plate, do you do that? Or eat out of their own dirty dog bowl could be fueling a superbug crisis. That's what a new study out of the UK warns. The study's published in the journal called PLOS. Here's what it reveals. Only 12% of people wash their dog's food bowls with hot water and soap every day. Only 22% say they clean their dog's food bowl once a week. 18% say they wash it every 3 months or less. So how often do you and others in your area, in our area, clean their dog bowls? I know mine isn't once a day with soapy hot water. We hit the streets to find out.
I don't wash them every time. I do probably every 4 or 5. I throw them in the dishwasher.
We don't have a lot of boundaries. He's one of our children. It's surprising. I mean, I've grown up with dogs my entire life, and I mean, I'd say every couple months when you notice some nasty stuff on it, like I'll wash it out for him, but we've never made that a standard practice, and all of our dogs have lived to be like 15 or 16 years old.
That same study we're talking about shows up to 15% of our pets carry a drug-resistant superbug, though. That could transfer to your face when you're snuggling with them or they're licking you or kissing you. That's not good. That's not what any of us want to hear when we love our pets and snuggle with them. So joining us to talk this morning about this study and the ways to keep your pets safe and you safe is veterinarian Dr. Neela Boyer. Dr. Boyer is a veterinarian at K-State, and she focuses on dogs and cats. Good morning, Dr. Boyer. Thank you for joining us. Looks like you might be on mute. Okay, we're going to keep going. So what kinds of superbugs are we talking about?
Can you hear me okay?
I can hear you now, yes.
Wonderful. So, there's lots of things that can be in our pets' mouths. And so that's one of the biggest things. And we know that most of us are probably going to stay healthy from those sorts of things. But if you're immune compromised, if you're an elderly person, if you're a child, those have a greater risk. And so I guess the good news is our commercially prepared diets are very safe. That doesn't mean 100%, but they can be fed very safely. But we should still be changing out those bowls. We should be washing them. I don't think any of us wants to eat off of a dirty plate. So I think we can consider the same thing for our pets.
How often do you think we should be washing our dog food bowls, though? I mean, I got to admit, I never thought I needed to wash it with hot soap and water like a regular dish. But should we be doing that, putting it in the dishwasher every day?
Well, the studies suggest that we should be doing that. And the reality is most of us probably aren't doing that. So I think it comes down to some of those basic hand washing and hygiene rules that we should all be doing a better job at, especially if we have immune compromise. Feeding raw food has a much, much, much greater risk as well. So that's also should be considered.
And why is the raw food a greater risk?
Right. So there's been several studies that have looked at that, showing that those types of foods, they often contain bacteria, and those bacteria can be really dangerous ones like salmonella and listeria, E. coli. And those are things that certainly there's been this association in the UK with those superbugs being produced. And some of these animals can shed salmonella for up to 14 days. So that's a risk to all of us from those pets. So when we care for those kinds of animals that are eating those foods, we have to be extra careful. And so that definitely carries greater health concern.
Any dog lover has, or cat lover, has gone in for the snuggle, and then they just lick you, and sometimes they get you right in the lips. Is that something that can actually get you that quickly? Should you be instantly run and brush your teeth? I mean, that's happened to all of us. Are we talking about a true risk here of just that quick contact?
Well, I think what we're mostly talking about from that evaluation is looking at over time how the bacteria can multiply in those food bowls, especially. So while we know that dogs and cat mouths are not sterile, the risk is especially when we have those food bowls sitting out and accumulating bacteria that are then sitting there and growing in that food bowl for a length of time. And that's going to be the greater risk.
Let me ask you this. I remember hearing my whole life when I was growing up, dogs' mouths are cleaner than people's. Dogs' mouths are cleaner than people's. Is that true, or is that just something someone says to you when the dog licks you on the face and you don't like it?
Right. I'd say that's an old wives' tale, but that is certainly
so they're not cleaner than people.
They're not sterile. Now, I can't say that I know what all bacteria people have in their mouths, but dogs and cats certainly do too. The reality, though, is that most of us, that's not going to be a problem. It's primarily, again, when we're accumulating those bacteria, especially when they're eating foods that are raw diets, because that does pose that greater risk of them shedding those bacteria that have greater human health concern.
There is an estimate that superbugs will kill about 10 million people every year by 2050. Does that report concern you as it relates to people and their pets?
It certainly does. I think we've gotten so much better in veterinary medicine and human medicine about preserving antimicrobials. So really trying to think about when we actually need those drugs and trying to be very cautious about which ones we pick. And we know that those drugs are not being produced all the time. So we need to be careful to reserve those important ones. And we need to be cautious about trying to protect our family members and our pets from those dangerous infections.
When it comes to picking up the dog waste in the backyard, I would imagine that is also a concern if you have kids that play in the yard or kids that walk through it and take it into the house. How does that rank as far as transfer from the animal's face to your face rather than that kind of infection?
Right. So with many, and I would say most of the fecal bacteria that can cause human disease, they have to be in the stool, in the environment for a period of time before they're transmissible, well, especially for the parasites and the protozoa. The bacteria, not so much, but that's actually really a greater concern as far as the bacterial infection. As far as parasites, the risk is from the environment primarily. So having an uncovered sandbox, going to the beach and playing in the sand that doesn't get washed and cleaned regularly, those are a risk to especially little kids. So they should be making sure to wash their hands and, avoiding putting, obviously, little kids love to put dirt in their mouths and things like that. So that's where we need to be more cautious if they're playing in areas where the stool and feces could have been in that environment. So, a dog park, for example, where we accumulate that kind of material is a greater risk.
I want to ask you a question about cats because you also are an expert in felines. People have the litter box in their house for the cat. Then the cat walks on the counter. They're in the litter box doing their business and they're on the counter or the kitchen table or the top of the refrigerator. Why don't we see more people get sick from that? Or do we and we don't know it?
Right. And I think, again, it comes down to the risk is still relatively low for most people. It's going to be a greater risk. We know that there are things like toxoplasmosis, which our doctors talk to us about when we're pregnant, and making sure that we're not cleaning the litter box, especially as it is allowed to sit in the feces and the waste. It's going to have this greater risk of transfer to women. But that risk also occurs from raw meat, for example, if we're handling those sorts of things during pregnancy. So really basic measures that we shouldn't be feeding a cat up on the countertop to encourage them to get up there, that we should be wiping down those surfaces before we prepare meals. And for majority of people, that's going to be fine. If you are somebody who has immune compromise, we just want to be more cautious and conscientious about those things.
When it comes to other animals besides cats and dogs, people have a pet bunny or people have chinchillas, animals of that nature. Is that the same concern? I've long since not practiced on a lot of those little guys, but I can tell you about many of the reptiles. Those have a greater risk of salmonella. So anyone who's handling those kinds of animals, we need to be making sure that we're washing our hands immediately after handling, especially if we're going to put our hands in our mouths or near our faces. Those species are going to carry much greater risk. So for those of you just joining us, we're talking to Dr. Neela Boyer, a veterinarian at K-State. This all started with us trying to figure out how often we should wash our dog bowls with hot soap and water. So are you a dog owner?
I am.
How often do you wash your dog's bowl?
Well, I have a new puppy and he's messy, so I am doing it more often on the order of what they're saying from this study. But that said, have I always done that? No, I think this study brings awareness to the need to be doing that, especially if you are battling any health concerns. And especially if you're feeding canned foods. And I mentioned raw diet as well, which, we could go into a whole lot about the safety measures there. But in general, a commercial diet is much safer. But still, I think I'm getting better about doing it more often based on this information.
Well, if you have a new puppy at home, anyone who's had a new puppy knows you don't have a lot of free time. You're just chasing them around from room to room as they try to chew up everything in sight. We're going to keep Dr. Boyer here because we have more questions for you coming up. And in about 2 minutes, we have some great news. Okay, we've told you the icky stuff, but coming up in a couple of minutes, we're going to tell you why having and loving a pet could keep your child free of at least one disease. So we're going to get to that in a minute. We also want to go to your questions from our community. Let me check it out here. I know they're coming in. Okay, Anne has a question. Anne Sulentrop, and this is a COVID question for Dr. Hawkinson. After getting a booster for COVID, would a COVID test always turn positive?
No, it shouldn't turn positive. After vaccination, you should not have any positive COVID test. That's not how the vaccine works. So, short answer to the question, you shouldn't have a positive test after the vaccine, again, unless you were infected.
I had people that knew I was going to be filling in for Jess today, and they all wanted me to ask you, what is your stance now on going out to the bars and the restaurants in Kansas City as we hit the summer months without masks on? I mean, that was resounding, and people asked me that in 10 different ways. So
yeah, again, I think it's taking that risk into account, understanding your risk, your bubble's risk. Are there people who are more at risk of of severe disease? So doing that is the first thing. The next thing is obviously being up to date with vaccination. And then just doing all of those things. We know that cases are increasing. We know the virus is circulating here around our community. So it's really taking that individual risk into account. But I would say the most important thing is being up to date with that vaccination.
We're going to get to the updated numbers in a second, but I want to ask if there are any reporter questions on the line. Any questions from reporters? Zero right now. Email them to us if you have any. We'll ask Dr. Hawkinson later on. Dr. Hawkinson, Medical Director of Infection Prevention and Control.
Yeah.
Love the latest numbers.
Yeah, they're still pretty good. We are kind of, again, seeing more circulation of the virus around the community as around the nation. Our active infections are still pretty low, not in that single digits anymore, but 11 active infections, 1 on the ICU, but luckily none on the ventilator, and 7 in that recovery period. So we are still seeing a trend nationally of increased cases that are being reported, but also increased hospitalizations. Right now around our community, I think we're still doing very well.
There's a new report that shows that the elderly still make up most of the COVID-19 deaths.
Yeah.
Can you tell us why that is?
Yeah, I mean, I think we know one of the biggest risk factors for severe outcomes is age, and I think that has to do with a lot of different things. Number one, it is more comorbidities. As you get older, you have more diagnoses of things like heart disease, lung disease, kidney disease, diabetes. Also, as you age, you do have some decrease in your overall immune function as well. We believe that is part of it. So it's a multitude of factors. But yes, age continues to probably be the highest risk factor for chance of getting to severe disease. We
have news out of Shanghai. Shanghai is posed to ease its restrictions as the infections there fall. What impact do you see that having on us here in the United States?
Well, I think it's going to be interesting to see exactly what happens in Shanghai and China in general. We know also that North Korea is supposed to be decreasing some of their restrictions. We'll see how it impacts that country itself as far as medical capacity and how those things go. We know it's going to be important moving forward because we know when there are shutdowns in China and in Southeast Asia, we know that can impact supply chains and production and all that. So I think hopefully this won't have too much of an impact there. And again, hopefully for those communities won't have too much of an impact for severe disease and death, obviously.
When we think back to a year ago, Memorial Day weekend, it felt like COVID was at the tail end. We were taking our masks off, traveling, celebrating, felt like it was over. However, cases were, I believe, 5 times higher yesterday as people celebrate. honored Memorial Day and
Yeah.
enjoyed each other's company and returned to those pre-pandemic levels, where do you see things going?
Yeah, I mean, I think we are still going to see increased circulation of the virus. What we are all hoping and what we have seen so far, and especially in the other countries with their latest surges, is that we haven't seen the increase in hospitalizations and death to the extent that we did in previous waves, also in the winter with the Delta Omicron wave. What we're really hoping is that that individual immunity people have gained, mostly by vaccination, but also infection and reinfection, is going to help keep people out of the hospital. But also don't forget, we have the early testing and then early Paxlovid as well. Those things will all help reduce your chance of coming to the hospital. That will help reduce the stress on the healthcare capacity, also allowing so that we don't have to go back to rescheduling surgeries and doing those types of things that we've done in the past. So I think it's mostly about individual immunity at this point, and it's that immunity not protecting from infection, but
Right.
protecting you from severe disease and hospitalization.
And the monoclonal antibody in treatment is
Yeah.
so helpful.
Yep.
As you know, I had COVID in April, and about 2 days in, I qualified for that, and I still felt horrible, but I
Yeah.
felt better.
Yep, and that's
felt
one
better,
other
markedly
thing
better.
we've historically been able to use, mostly for those people at high risk.
Yeah.
We still are able to give some of that out, but also understand as we see new variants, those variants can be resistant to those monoclonal antibodies. But luckily, there are other companies out there creating new ones for any possible new variants as well.
I want to bring you into our conversation that
Yeah.
we were having with Dr. Boyer about the risks
Yeah.
that pets can pose, or having a pet can pose, to catching a superbug from
Yeah.
having them in your face. What's your experience with this in your specialty?
You know, I mean, I think we all know where dogs lick and put their nose, and
Right.
when you then get a
Thank you for
kiss
that.
from that dog, I just think that probably isn't the smartest thing to do. I do see this every day, though, in my practice as well. You know, we have people with especially diabetic foot wounds. So their feet are open, they do have wounds on them. It is not uncommon for those pets at home to be licking those wounds for one reason or another. And we do see those infections with those specific bacteria that we know are found in animals' mouths, particularly dogs. So it is an issue. I just continue to reinforce the fact that it's probably a better idea if you're not letting your dog lick you.
Sometimes you don't have a choice.
I
Have you
know.
met my dog?
No.
She knows what she wants and she goes in for it.
Okay.
She will lick your face even though you
Just
are an
wash your
infectious
hands
disease.
well and wash your face.
Wash your face. Thank you for that. Okay, the questions are starting to roll in, both for you and Dr. Boyer. I'm going to ask this one to Dr. Hawkinson.
Yeah.
Let's see. Katie writes, does the University of Kansas Health System recommend EvuShield?
Yeah. Oh, absolutely. We are doing it. We have a tiered system
What
and a
is
lottery
that?
system. So EvuShield is
EvuShield.
a prophylaxis monoclonal antibody that is given to people who cannot take the vaccine for a medical reason or for one reason or another, or even if they've had it, they are high risk of not having an immune response, i.e. they are on some immunosuppressive drugs. So this is a monoclonal antibody injection. We are getting supplies. We do have a system to get those people who are unable to get the vaccine to get it. We are giving it on a daily basis in our clinics for those doctors that have those, especially those immunosuppressed patients.
And then one more question for you, and then we're going to get to the good stuff, the good news about owning a pet. Kathy wants to know, I've known several here in Southwest Missouri having COVID for a second time. All are vaccinated.
Yeah.
So when should they get the next booster?
Yeah, so the typical recommendation or guidance for the CDC is really after you've had COVID, and this is still true from what I understand, you don't really need it for 90 days. You don't need the booster or anything. You are considered somewhat immune. Don't have to be testing again. What we have been saying here on the show is really any time in that 8 to 12 week period after the acute infection, it's reasonable and okay to go get that vaccine. Now, certainly you can wait if you've just had it and we think the numbers are going down, or it's the same variant. I think that's important as well. And then wait till longer, maybe wait till earlier in the fall when there might be some new recommendations for boosters. So really the general guidance is at least 90 days. We've been saying, the 8 weeks to 12 weeks, which it was still in that time period, but there's no specific hard and fast guidance for that.
We want to continue our conversation with veterinarian Dr. Neela Boyer. She is a veterinarian at K-State, specializing with cats and dogs. We thank Dr. Boyer for being with us. So we told you the creepy stuff, now for the good stuff about having a pet. There is so much good about having a pet. There is another study showing that long-term pet ownership could help older adults retain their cognitive skills. Dr. Boyer, why is that?
Right. That's a really interesting thing to look at. So we've known for a long time the benefits of pet owners or pet ownership, I should say. And here we look at specifically cognitive function. And so for one, we know the health benefits of owning a pet as far as being responsible for feeding the animal, being responsible for exercising the animal. And so we know that health and cognitive function, physical health, go hand in hand. But here it also looked at over 5 years of pet ownership, those benefits. And even before 5 years of pet ownership, there were benefits where people were maintaining some of their sayings, words that they were choosing, that they would remember things a bit better by having an association with pet ownership. So I think it's really a fascinating look at how we need to be supporting that ownership in those. And these were 65 years of age and older people that were maintaining a stronger cognitive skill as they got older. So very exciting information. We should be supporting pet ownership, especially in those older people.
Dr. Boyer, I'd love your take on another study that came out. And there have been a bunch of these studies about dog breeds. And this particular study shows that the breed does not predict behavior, and they studied more than 18,000 dogs for this. Do you agree in your professional experience, and what have you seen as a veterinarian?
I 100% agree with that. So with regard to this study looked at that, and they said that about 9% of the traits were associated with breed specifically. So we see that all the time where somebody adopts a breed and they expect a certain characteristic profile from that animal. And really, dogs have lived with us for 10,000 years. They've been watching and learning from people, but we've only been modifying breeds for a small amount of time relatively. And so really thinking that breed alone is going to make up that determination is very naive. So this study proves that there is a lot that goes into how a pet behaves and how they respond to stressors in their world. And a lot of that comes down to environmental modification.
I have a question for you about leptospirosis, also called lepto. A lot of people will refer to that in short. A life-threatening bacterial disease. Dogs can get it. Veterinarians and researchers at the University of California believe they've developed a new way to detect it using artificial intelligence. Can you tell us a little bit about that?
Yeah, this was a study that was just released, and some really exciting data out of this, where they studied for over a year dogs in the hospital that were being tested with basic laboratory testing that we'd look at for any sick animal that they'd be considering leptospirosis. And what they found is that in a subsequent use of that data, they showed that they were able to predict with 100% accuracy who was going to have leptospirosis based on that basic lab work. And so really exciting that hopefully in the future we'll have that online, where we can go on as general practitioners, as specialists, and enter some of that basic laboratory testing that we're doing in a patient we suspect lepto, and predict the likelihood of them having that, so we can start earlier treatment plan for that animal, because early treatment can mean much greater chance of survival.
Dr. Boyer, I have a viewer question from Joellen McGranahan. She would like to know, what material do you recommend for pet food bowls? And seriously, if humans don't eat off dirty dishes, why would you allow your pet to do so? Oh, Joellen, I feel so embarrassed. I let my dog eat off a dirty bowl. Yeah. I've been shamed. I will wash Gracie's bowl more often. Buster didn't get it either. Okay, so what's your take, doctor, on the material that we should get for our pet food bowls?
Right. I think here where the dishwasher is going to be commonly used by a lot of people for ease. And so making sure that it's a dishwasher-safe material. So I would suggest using stainless steel or glass, porcelain type of material that can be cleaned, I guess I should say, in a dishwasher. Or if you're going to use the sink, dishwashing soap, hot water was also shown versus cool or lukewarm water to have a better ability to kill those germs. So I think anything that can go into the dishwasher is probably going to be a safer bet, and anything that doesn't have a lot of porous little material in it, that you can easily clean it and remove those bacteria.
Isaac has a question. This one's for Dr. Hawkinson. Isaac writes, I read an article today, I believe in the British newspaper, The Guardian, saying that cases in Britain have come down. What does that mean for us here? I know, he writes, he continues, that the trends in the UK often precede similar ones in the US.
Yeah, Isaac, Thank you. He always keeps me
Keeps
up
you
to
on your
date
toes.
with the latest news. So certainly that seems to be true, especially in the UK and obviously South Africa. We are hoping that trend follows because, just like you said, we know that in previous waves or in previous iterations, we know we have followed suit with some of those other countries, such as the UK and South Africa. So I believe we're hoping for that now. But all throughout this, we are also hoping that those hospitalizations don't reach that large peak that they did. So I think it's all very good news, and it's just one thing to watch out for and continue to hypothesize and believe that will happen. But time will tell. But we certainly believe, because we have seen this in the past, that probably the same trend will happen as well.
Boy, I hope
Yeah.
we see the end of this soon. I want to get our final thoughts from our guest. Dr. Boyer, I want to start with you. And again, thank you for taking time to join us.
Thank you.
Do you have any final thoughts that you'd like to share with our guests about this topic?
Specifically, which one are we referring to? Sorry.
Oh no, I'm talking about
Just
the whole 9 yards. Whether it's
The
clean
whole
your dog's
thing.
bowl, Alexis.
Yeah.
Don't let the dog's bowl go too long with being dirty, or it's talking about
Right.
breed-specific trends, things of that nature, or even the benefits of owning a pet. I love when veterinarians talk about that.
Yeah, well, I'll talk about the benefits of owning a pet. I mean, we know that the health benefits are there. We know that children that are, when they're young, when they have a pet, some of those health risks like asthma can go down. We know that now there's data to show us the cognitive improvements. And I really do appreciate them looking at a study of 18,000 dogs to assess behavior, because we've known that for years in the veterinary profession, that we should be gauging dogs individually rather than by a breed profile. So I think it's wonderful news to see that type of work being done. I also think that looking at the benefits, dogs have been living with us for so long, and looking at how they can interpret human behavior, how they can help us to also navigate our world, and how they listen and how they learn from us. It's fascinating, and it's something that the benefits we're currently learning that, but there's so much more to come.
Dr. Hawkinson, any final thoughts?
Yeah, I mean, I agree. I think pets are extremely great and wonderful and provide so many benefits. And just to paraphrase Dr. Seitz, the rules of infection prevention travel with you wherever you are. This includes, especially at home and with animals, whether it's dogs, cats, whether you have reptiles, whether you're giving little chicks to your kids during Easter. We know that's a popular thing. Remember, it's vitally important to wash your hands, especially if you're having any excrement from the animals, or just holding and letting the animals lick your hands. Continue to do that good hand hygiene. That will help keep you safe as well.
We do have some big headlines this morning, and one that will affect you every day now that the unofficial start of summer is underway. We have changes here at the Morning Medical Update, and for this we go to Jill Chadwick, who is our news director, who's joining us to fill us in on what this means for all our viewers.
Yeah, hey, it's so great to hang with the cool kids.
I love being on the desk with you. This is
thanks.
fun.
Yeah, it's fun, and we so appreciate you showing up every day too. Here's what I want to tell you. We are starting tomorrow going to a summer schedule, and it will continue until after Labor Day. What that means is that on Tuesdays and Thursdays going forward, we're going to give you encore presentations of some of our more interesting shows. It'll be fun to watch what you've seen before. It will also be awesome to kind of take a look back and where we were maybe this time a year ago. It'll be kind of sort of fun. Every Monday, Wednesday, Friday, we'll still be here live. And should there be a surge or any reason for us to be live, we'll be here. So what are we going to be doing on Tuesdays and Thursdays if we're not doing this? We are going to be working hard to bring you great content for in the fall. And this is where you can help out. Please write to us either in one of the threads or to the Medical News Network and let me know what health topics do you want to hear from us about. We will get those on the schedule for in the fall and look for great patient stories. We so appreciate you.
And it's so great. A lot of people might not realize how open you are, Jill, to getting viewers control what we show. What's important to you, it's important to us.
It's all for you guys.
Yeah.
It is all for you guys. I'm constantly telling them, make sure you give them enough time to answer and ask questions because we know that's what brings you back every day, and we so appreciate it. We so appreciate it.
Well, thank you for being with us today. This was fun. And remember that you can catch our shows by logging on anytime to Facebook, YouTube, and Twitter. And as we leave you this morning, we would love to share some snaps of our pets here on the media team. Let's just see if you can guess whose dog belongs to who. Take a look.
Forget phasers or warp drive. Did you know that NASA has played a big role in a lot of medical advances here on Earth? Coming up Wednesday on Open Mics with Dr. Stites, the science behind the research helping those with cancer, reproductive issues, and even your DNA.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.